Hi, I'm Zoe Broussard. I'm a student nurse at the University of South Alabama, and today I'll be performing the injection site video. This is my badge, and then this is the room. Alright, the first site we're going to do is the deltoid. So I'm going to come over here and I'm going to lift up the shirt. Alright. So you can find the deltoid muscle by lifting the arm, and you can see that big muscle right there. Alright, so the deltoid attaches to the humerus and in the middle of the upper arm, and that is called the deltoid insertion. And we do not, for the injection, we do not go below the deltoid insertion, and we do not go above the shoulder. So to find the exact spot to give the injection, we're going to find the acromion process, and we're going to go 3 fingers down from there, and we're going to make a V. And in this V is where you can give the deltoid injection. It is an intramuscular injection, so it is a 90-degree, it goes in at a 90-degree angle with a small needle and a small amount of aqueous solution. Alright, the next one we're going to do is the dorsolateral aspect of the upper arm. This one is, like I said earlier about the deltoid insertion, it's 3 fingers down from the deltoid insertion and 3 fingers above the olecranon process. So in this area, this rectangle right here, we can give that subcutaneous injection. So it could be given at a 45-degree angle or a 90-degree angle, depending on the size of the needle and the amount of tissue. The next one is the forearm. So I'm going to take her arm and I'm going to go 4 fingers down from the antecubital fossa and 4 fingers above the wrist. So in this rectangle area, we can give that intradermal injection. So an intradermal injection will go underneath the dermis at a 15-degree or less angle, and we will have to be careful of any blood vessels or tendons, and also we should see a bubble whenever we do this injection. Alright, the next is going to be the abdomen, so I'll have you stand up for me and we'll come closer to the camera. Alright, so for this one, for the abdomen, it is a subcutaneous. It's used whenever there is multiple injections needed, like heparin or insulin, and we keep a 2-inch border around the umbilicus that we stay away from, and we also do not go above the costal margins, and we do not go below the pubic area, and we don't go past the anterior superior iliac spine. So it makes about a U shape for us to give these injections, and there are several areas where we can give this injection. And that is given subcutaneously at a 45-degree angle or a 90-degree angle, depending on the size of the needle and the type and the amount of tissue. And then I'll have you lay down sideways and face me. Okay. For the ventral gluteal, we will find a greater trochanter first. So in order to find that, I'm going to move this leg. Alright, so I found the greater trochanter. I'm going to go ahead and place my the heel of my palm on the greater trochanter, and you can face me a little. Alright, I'm going to place my thumb towards the groin, and I'm going to place my index finger towards the anterior superior iliac spine, and I'm going to place my middle finger to the iliac crest, and I see a V shape right here. And so I would palpate first and give that injection right there. So if the patient is bonier, if you feel more bone, then you can move it around. It just varies with each patient because each patient is different and everyone's body is different. So you would palpate first, and then you get that injection at a 90-degree angle, and that is a preferred injection site for the intramuscular. And then we have one more, so I'll have you sit up for me. Okay, so the next one is the vastus lateralis. So I am going to feel for the greater trochanter by moving the knee up and down. And then I'll go a hand spread lower than the greater trochanter, and a hand spread above the knee. And for this injection, we cannot go past the midline of the leg, and we cannot go past the side midline of the leg either. So we have like this rectangular space to give this injection. It can be given subcutaneously on the anterior thigh at a 45-degree angle, or a 90-degree angle, depending on the size of the needle and the tissue and the amount of tissue, or intramuscular at a 90-degree angle. And that concludes my injection site video.